A statistic from Children's Grief Awareness Day website states that one child out of every 20 children will have a parent die, and that number doesn't include those who experience death of a sister or a brother or a close grandparent or an aunt, uncle, or a friend. What would you do if you were put in a traumatizing situation at a young age? Imagine someone who is vital in your life and is vital to your everyday life, and you lose them suddenly. Imagine the kids that go through that types of tragedies every day. Most people would agree that when a child loses somebody that they need some sort of help, but there's been a lot of debate on what kind of help that is. Therefore, counseling and other options have again been debated. According to an article in the School Psychology International Journal, most children are able to negotiate the grieving process. So counseling is not always just the number one option. That's why there needs to be other ones. Children are a lot more resilient than adults and should be not be forced into counseling. Therefore, the speech gives other options that should be given to help children who are experiencing grief. Because every child is different, they also each grieve differently. Therefore, letting them deal with their own grief can be very beneficial to just everyone involved. From Supporting Children with Traumatic Grief, What Educators Need to Know article in School Psychology International Journal, grief is an ongoing process that does not have a statute of limitations. Children do not get over their grief, but like adults, learn to live with it and adapt to the loss of a parent, sibling, or the loss of another loved one. It's not always beneficial to a child that's grieving to constantly remind them of the person that they're grieving for, or just constantly having to talk about it. According to the Child Mind Institute, little kids go in and out of a grieving state, so it's okay for them to play alone, but you still be in the vicinity just in case they go back into that grieving mode. When it comes to teens, Child Mind Institute suggests to tell them that you're there. It's going to take a process to get through this, but they can ask any questions and come back to the topic at any time. In the bigger picture, children don't always need to be hovered over. In the end, they decide how they want to grieve. Different ways to grieve cannot be forced on anyone, or just a specific one that you want them to do. It just can't be forced. And that's why that there needs to be other options to children to grieve. Here are some alternatives to counseling. If it can be afforded, pets are a great companion for grieving children. An article in the Journal of Pediatric Health Care called Alternative Therapy for Children and Youth with Special Healthcare Needs states positive interaction with animals, even if it's just one's physical presence with them or an empathetic feeling toward them, seems to benefit children. From the same article, a survey of families recently acquiring a pet found that 70% increased domestic happiness, 60% an increase in outward sign of affection toward the pet, and 52 report an increased family time spent together. Now, according to an article in the Journal of Creativity and Mental Health called Resolving Child and Adolescent Traumatic Grief, Creative Techniques and Interventions, when someone dies in a child's life, they can often feel like they are losing control of their life. They just can't get a grip on things, and therefore the article suggests that children take part in creative art exercises. The article suggests using creative interventions can facilitate a sense of control by allowing these children to have choices on how they approach their grief treatment. Regardless of the intervention, they may get a sense of control by choosing the words and colors and artistic mediums used on the topic that they're exploring. Another way for the child to express themselves without the pressure of doing so is just getting them a journal. I know from experience that journaling really helps with just evaluating life and how I feel about things, but at the same time, I felt like journaling makes my feelings real. Just putting them on paper, it just makes me have to tackle those feelings, and that can be really hard. But in the Journal of Creativity and Mental Health, they have said that journaling can highlight connection between thoughts, feelings, and behaviors, and provide an outlet for a range of emotions that child may not yet feel comfortable verbally expressing. Um, Furthermore, this expression can help with self-care. You can just say what you've eaten in the journal, just how you're feeling that day, just so many things that help you just reevaluate what's going on inside. This article mentions how enhanced self-care is important as an indicator of an adjustment to a loss and a protective factor against the negative psychological and physical impacts of this trauma. Overall, there are other options for children other than sending them to therapy, and here are some of the benefits. These solutions may salvage the child's relationship with the people that's close to them and allow the child to adapt to the adverse situations. Um, the children need to have relationships after something traumatic happens and they are going through grief, just to be able to get their minds off things and just have some kind of normalcy in their life as they're trying to sort through things by themselves and what's going on within them. Furthermore, as the relationships grow, trust also grows with the child and they can express their feelings and what they're actually going through to an actual person. And allowing the child to adapt to their accomplishments, or allowing the child to adapt to grief, allows them to feel like they are in control of their life and that they're not going to be dependent on somebody in the future to make those big decisions about themselves. And it can make them more accomplished in the future and more mature. Um, like I've said before, children just do not get over grief. They learn to deal with it. But who better to understand how to deal with their grief than the person that's going through it? However, you may be asking, what is the best option for the grieving child in your life? Unfortunately, children cannot be shielded from death around them. Grief, therefore, is a very common thing, and again, it's just something you have to adapt to be successful in life. If the grief is not dealt with, it can leave lasting effects on their lives. The best way to deal with grief is kind of a trial and error thing. Don't just push them on things that they're just obviously very uncomfortable with. There may be further down the future where they will be more comfortable, but just pushing certain agendas is just not going to work with children. There must be alternatives like the animals and the journaling and the creative art. And just really letting these kids just adapt to their life and just be there for them when they're ready to talk about those hard things. And like the article in the School of Psychology International stated, most children are able to negotiate the grieving process without any lasting scars. So don't be afraid to mess up on how you approach a grieving kid. Just the action alone shows them that you care. And I like to show you guys some illustrations on grieving. Let me get this pulled up real quick. Okay. So on the left, there's some stages of grief, and then just comedically, there's my experience. So it's okay to fall back to those past experiences of how you were feeling through grief. And here's a little chart of what the typical experience of grief. There's first denial and isolation, there's anger and blaming, there's bargaining, depression, acceptance, and healing. And finally, here's some causes of grief. It's just the death of a loved one, suicide, loss, divorce, loss of job, death of pet. Thank you for your time, and that will be it.